Good evening. Well, I'm saying good evening, but good morning, good afternoon, good evening. Today is the start of a new module, Module 155, Radiology. Today is the start of Module 155. If you have not completed all assignments, exams, labs, please send me an email and submit everything you would need to. Grades need to be turned in as soon as possible. So again, welcome to Module 155, Radiology. This module is not as long as the previous ones. This module is 20 days long, so it will be going by pretty swiftly as some of the other modules have. So we're going to go ahead and get started. Again, radiology. Chapter 24, Radiology. Learning objectives for Chapter 24. After completing this chapter, you would be able to, 1, demonstrate an understanding of radiology terminology, analyze the elements of component coding and reporting radiology services, identify elements of the global procedure, state the appropriate coding of contrast material, explain the format of the radiology section, demonstrate the ability to code radiology services and procedures. The format of the radiology section. Radiology is the branch of medicine that uses radiant energy to diagnose and treat patients. The term originally referred to the use of X-rays to produce radiographs, but is now commonly applied to all types of medical imaging. A physician who specializes in radiology is a radiologist. Radiologists can provide services to patients independent of or in conjunction with another physician of a different specialty. That's important to understand. A physician who specializes in radiology is a radiologist. Radiologists can provide services to patients independent of or in conjunction with another physician of a different specialty. The radiology section of the CPT manual is divided into 2 subsections: diagnostic radiology, diagnostic imaging, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, nuclear medicine. So in this chapter in radiology, you're going to see there are a lot of different things that's going on. You have radiology terminology. The following words end in graphy, meaning making of a film. So you know that suffix graphy means making of a film. So whenever you see in graph, you know that that is the film of something being taken a picture of. For example, in angiocardiography, angio means vessel and cardio means heart. So angiocardiography is the making of a film of the heart and vessels. What do the other graphy words mean? So this is one of your exercises here, which should be easy to determine once you look at it. Angio, it says here vessels, cardio means heart. So on here, that first term, which is here for you in the meaning, heart and vessels. Aortography, or they can say it in different ways. Aortography or aortography. What is this? What is the meaning of this? And remember, try to look at that prefix and suffix. Don't always look for the answer. Try to break it down. So what you already know is that graphy is a film of. It's a film. So put all of these together and you can get the meaning without definitely have to go to the back of the book for the answers, but then you can check your answers in the back of the book. Next. For example, If a patient undergoes a radiology procedure in a clinic that owns its own equipment, employs its own technologists, and also employs the radiologist who supervises, interprets, and reports on the radiology result, the global procedure is reported. So this is going back to understanding how you report such services. How do you understand and go about such services? So this is known as your guidelines. So the guidelines always states, let me go back a slide. The guidelines is going to let you know on how to report the services. So in your guidelines, it states, as with all guidelines, the radiology guidelines should be read carefully before radiologic procedures or services are reported. So make sure that you're reading your guidelines before you report any procedure. The guidelines contain the unique instructions used within the section and the indications of multiple procedures, separate procedures, unlisted radiology procedure codes, and applicable modifiers. Guidelines that are used more commonly in this section than in others are those explaining the professional, technical, and global components of a procedure. These components are as follows. Professional describes the services of the physician, including the supervision of the taking of the X-ray film and the interpretation with report of the X-ray films. Technical describes the services of the technologist as well as the use of the equipment, film, and other supplies. That's the technical component. So remember, professional describes the services of the physician, including the supervision of the taking of the X-ray film and the interpretation with report of the X-ray film. So the interpretation means the findings, the readings with report of the X-ray films. The technical component describes the services of the technologist, as well as the use of the equipment, film, and other supplies. Professional, the physician; technical, the technologist; equipment, film, and other supplies. Global describes the combination of the professional and technical components, 1 and 2. For example, if a patient undergoes a radiology procedure in a clinic that owns its own equipment, employs its own technologist, and also employs the radiologist who supervises, interprets, and reports on the radiologic results, the global procedure is reported. Again, global describes the combination of the professional and technical components, 1 and 2, professional and technical. For example, this is an example of how you would report this. If a patient undergoes a radiology procedure in a clinic that owns its own equipment, employs its own technologist, and also employs the radiologist who supervises, interprets, and reports on the radiologic results, the global procedure is reported. But if the radiologist is reading and interpreting films that were taken in another facility, only the professional component would be reported for physician services. So this is where we're going to stop for today on the first day of chapter 24, the radiology section. And I need you to watch this film, to watch this video, and to explain to me the difference. So this will let me know if you are actually watching the video. I need for you to explain to me, why is it important to know if it's professional or technical? Why is it important to know the professional component, and why is it important to know the technical component? Submit that for an additional 5 points. The professional component describes the services of the physician, including the supervision of the taking of the X-ray film and the interpretation with report of the X-ray films. Technical describes the services of the technologist, as well as the use of the equipment, film, and other supplies. So please explain to me the differences and give me an example of what would be a professional component and what would be a technical component. Give me an example of what would be a professional component and what would be a component of a technical component. This is what we will cover. Remember, please upload your assignments. If you're unable to upload your assignments, please post it in the comments section, email it to me, or text it to me. Remember, every Thursday for 4 p.m., we are having our Zoom class. Please get off to a good start. This is day 1 of a new module, Module 155. Please make sure that you're logged into the new module. If you have any questions, please get in contact with me. Thank you. We will continue on Friday with another video, but on Thursday, we will go through the rest of these slides. Thank you. Bye-bye.